All right, everyone. I'd like to welcome you all to the National Coalition for Homeless Veterans, NCHV's listening session on the housing needs of aging veterans. We're really excited today. We have a lot of folks who've signed up to be part of this listening session, which just demonstrates the interest and the need in this topic. My name is Cindy Borden. I'm the Director of Training and Technical Assistance here at NCHV. We're still letting a few folks in, so I'm just going to pause for a second as we get a few more folks in, and then we're going to kick right into the session today. All right, so we're going to keep admitting people as they come. We're glad you're here. As I said, I'm Cindy Borden. I'm Director of Training and TA here at NCHV. I want to just quickly go over our plans for today's session. It is a listening session, so we are going to have some breakout rooms later this afternoon, where you're going to have the chance to share your thoughts and your experiences in working with this population. But first, we're going to start with a little bit of an overview of the project that led us to this point today. It is a project that started about a year and a half ago or so. Then we're going to go through some of the key themes that we learned through this process. And then we're going to go into the breakout rooms where you'll have a chance to talk about one of those themes. Each of you will be going into one breakout room focused on one of those themes. And as we get to that point later, I'll explain that there will be a chance to add your feedback to other themes, as well as just general feedback on what we're doing. And then last, we'll go into some next steps about where NCHV is taking this project moving forward. So with that, we're going to get started. So the first thing I'd like you to do, and you can do this at any point over the next, half an hour, you don't have to do it right away, but I would like you to go on your phone or open another browser on your computer and go to menti.com. So it's there on the screen, menti.com, and enter the code that's here in red, 262-45951. And I want you to answer this question, which is, what are the biggest challenges facing aging and elderly veterans, either at risk of or experiencing homelessness? And it'll let you do up to 3 answers. So over the next few minutes, when you have time, just go in there. We're going to put the code in the chat as well, so you'll be able to find it if you forget it. I'm going to stay on the slide for just a second so you can write it down. But it's just menti.com and put in those code letters, and then the question will come up, and it'll allow you to type in up to 3 different answers for that. And we will come back to this later in the session. So go ahead and do that whenever you have a moment, and then we'll come back to this question around the challenges. So just to give a little bit of context and set the stage for how NCHV came into doing this work in this project, is over the last couple of years, we've been hearing a lot from the providers that we work with, from other stakeholders, from our partners, about the challenges of serving veterans who are aging and experiencing housing insecurity at the same time. And I just wanted to level set a little bit with a few numbers, not too many numbers today, but there are more than 18 million veterans currently that are in this aging population, over 65. And more than half of those have at least 3 chronic conditions. And as we get into the themes later, you'll see how those chronic conditions can impact some of the barriers and some of the themes that we found. Interestingly, during the pandemic, so from 2019 to 2022, the number of people that were experiencing sheltered homelessness declined dramatically over that 3-year period. But the number of adults that were 65 or over actually increased by about 10,000 during that same time. So something is going on. There's something happening here. And we also know that there are many different pathways into homelessness for aging and elderly veterans. 2 of the most common that we found in the project that I'll talk about in just a minute were either those folks who have been chronically homeless and they are aging into that, they are chronically homeless and becoming aging and elderly as they grow older. But then also increasingly, there's a number of veterans who are experiencing homelessness for the first time after age 50. And as you can guess, those 2 pathways have very different implications and services and the experiences of those folks and the providers who are trying to work with those veterans. Okay. So now a little bit about the project. As I said, this project is about this report and this listening session are probably about a year and a half to 2 years in the making. But NCHV was able to secure some funding from TAC, the Technical Assistance Collaborative, and NEF, the National Equity Fund, to help us secure a graduate fellow to help us look into this phenomenon that we were hearing about aging and elderly veterans. And we really wanted to get a better understanding of what the current needs were in serving this population, and also what the gaps in services were. And then secondarily to that, we then wanted to see, are there any promising practices out there? Are there solutions? Are there things that could be expanded or taken to scale? So what can we do about it? So what are the challenges? What are the needs? What are the gaps? And then what are people currently doing about it? Or what are some good ideas about what to do about it? And so then we took on this project. As I said, we had a part-time research fellow who came in and helped me with this process in this project. And there were several steps in the process. First of all, it included a literature review of what is out there. And I will say there's not a lot about aging and elderly veterans experiencing homelessness in the literature. We then did some interviews with key stakeholders, and those key stakeholders were in various systems that touch this population. So the veteran system, but also the aging system, the homelessness system, and sort of got some interviews with them about what they saw as the challenges and promising practices. Then we did an online survey of service providers to get both their ideas of what their veterans were experiencing, but also what they as providers were experiencing. And then those surveys actually informed a series of focus groups. And we had two different kinds of focus groups. The first set of focus groups were with service providers, and we had a series of questions that we went into to talk to them specifically about the veterans in this population that they were serving, the needs of those veterans, but also their challenges in trying to serve them and meet those needs. And then we also had focus groups with veterans themselves. For this project, we defined aging and elderly veterans as those who were 50 and older. We found in the research that there were various definitions. That's one of the challenges, is there are various definitions of what it means to be aging or elderly. And so that's one of the challenges, but we decided to define it as 50. And part of the reason for that is because we know that when veterans are experiencing homelessness, or when people are experiencing homelessness, they tend to age, they're physiologically age prematurely. And so many cases, a veteran who's been experiencing homelessness, who's 50, might have some of the physical health characteristics of someone who is much older, maybe 70 or 75. And so that's why we use that definition. But in those focus groups, we had about 80 veterans over the course of the focus groups. We did pay them for their time as part of to participate in the focus groups, but really to get their experience with that. So all of that combined together is what led to the Housing Needs of Aging Veterans report. And I think there's going to be a link to that in the chat. If it's not already there, it'll be there. And then this listening session as well. So this listening session is kind of the next step. We're going to go through kind of the findings in the report and then get your perspective on that. Okay. So what we found through all of those different aspects of the project, we kind of identified 4 major themes. And we're going to go through each of these themes in a little more detail. But if you want more detail about any of these themes, I encourage you to go into the report. You'll notice that these are in different colors. The colors that are here on the slides actually match the colors of these sections in the report. So it should be easier for you to find those if you have specific interest in one of these themes or other. And we'll do kind of a very high-level overview of those right now. So the 4 themes, the first one is that the housing needs of aging veterans are very nuanced and complex. The second theme is that the lack of coordination and integration across systems makes providing and accessing resources more difficult. So there's a coordination problem. The third one is that a holistic approach that ensures veterans have access to quality support services would improve their housing outcomes and their quality of life. And then the last theme here is that the complicated funding streams that exist around serving this population are confusing, and they actually make it harder to provide the services that these veterans need. Okay, so next we're going to go into each of these themes in a little bit more detail. So the first of the themes is this idea of housing needs, and the housing needs being really complicated and nuanced for this population. And as we were determining and going through what we found and what people said in the focus groups around housing needs, we really found out that housing really consists of there's more than one aspect to housing and the housing needs. The first aspect is probably one that everybody's familiar with. It's not unique to this population. It's pretty universal right now in this country, is that cost of housing, affordability of housing, is by far the biggest and most common challenge that we heard across all the focus groups, across the interviews, across the surveys. So affordability is a really key piece of meeting those housing needs. But affordability is more than just high costs of housing, and it's certainly high cost of housing is incredibly important, but it is more than that. It's about quantity and quality of housing. And affordability is not just what is my rent, what is my monthly rent, but it's also, does my monthly rent exceed the amount of vouchers that are available, and by how much? Or are there really high entry requirements to get into housing? First and last month's rent, security deposits, are those really, really high? And in many cases there are. Another component of this affordability piece is, and we've seen it increasingly over the last couple of years, is what happens when a lease comes up for renewal and rents are increased exponentially. That's a component of cost. So while somebody may have been able to afford their rent, when their lease ends and it's renewed, the new rate is too high and not something that can be met. And then also part of affordability is this idea of competition with other low-income rentals. Because there's not enough housing, because housing is too expensive, there's a supply shortage. That means that these aging veterans are competing with other low-income people for a very limited number of spaces. And so that's all part of the affordability piece. The other part connected to that is this idea of quality of housing. And we heard a lot that while there may be a unit that's available, that unit may not be quality housing for any number of reasons. And that included the unit itself. We heard about mold, we heard about rodents, we heard about appliances and even things like heating that didn't work. And then also where those units are located. And we heard over and over again about the units being available in neighborhoods that were not safe for this population to live in. So that's the affordability piece. The next part of the housing needs is accessibility. And accessibility is both a challenge at the unit level, so the individual apartment unit level, being accessible to people who have disabilities or physical challenges or other things, but also at the system level. And so when you think about accessibility at the system level, it means the housing continuum system. So is emergency shelter, for example, accessible to an 80-year-old veteran in a walker? If it's a dorm style unit and there are, bunk beds, so that accessibility is both at a unit level, but also at the system level. So our emergency shelters, our transitional housing, permanent supportive housing, are all of those things accessible to people who have different needs and abilities and challenges. The last piece of the housing needs puzzle here is this idea of adaptability. And so adaptability is basically, is the housing adaptable in a way that can grow with the veteran or change as the veteran's needs change? So is the space adaptable? Is a unit adaptable, for example, so that instead of it being can a one-bedroom unit become a 2-bedroom unit that allows space for a caregiver? Or can it, are there flexible unit sizes within a property that would allow a veteran to transition from maybe an SRO situation into a place where a caregiver could be with them? So is the space flexible and adaptable, but also are the services provided and available adaptable as those needs change? So within each of the themes, we developed some promising practices, or we identified some promising practices that were already in the field. I'm not going to go into those in depth here. They're all in the report, and so you can look at those. But specifically around the housing needs piece, some of the promising practices were using the SSVF, Supportive Services for Veteran Families, shallow subsidy, as a way to subsidize rent until perhaps an older veteran could get into more affordable housing. Reconfiguring spaces, both shelter spaces, transitional housing spaces, permanent supportive housing. And some of that happened by necessity during the pandemic, but being able to do that in a way that then allows veterans to have access to those spaces. And then again, having flexible spaces of variable sizes. And then lastly for this, before we move on to the next theme, are the recommendations that we developed specific to nuanced housing. And really, we had 2 recommendations in this specific theme. And one is to really work to develop new subsidized housing that's really designed for low or no income aging and disabled veterans. And then the second piece is to prioritize the adaptation of those existing spaces across the housing continuum, so that they can be accessible and adaptable to meet the needs of veterans as they age, and perhaps as they age in place. Okay. So that's theme 1. I'm going to move on to theme 2, which is coordination and integration. And one of the things that we found is that the lack of integration coordination is really impacting this population, this aging veteran population specifically. And part of that is because this population fits a niche where there are 3 major systems that are working in serving this population. And there are many more, but there are a minimum of 3 that are very involved in that. And that is the homeless system, the veteran system, and the aging system. And those 3 systems are all very different and in many cases siloed. But in order to best meet the needs of this population, those systems need to talk better to each other. So that's integration across those systems and coordination across those systems. Also across levels of government. So, and some of this will come into play later again when we talk about funding, but how do federal and state and local programs and services and models interact and coordinate with each other in a way that best meets the needs of the veterans? And then lastly, within systems, and specifically we found this within the VA itself, the Veterans Health Administration, the Veterans Benefits Administration, not always being integrated and coordinating. And even within some of those systems, not all of the programs always being coordinated and integrated. And we also heard that oftentimes somebody would be an expert in their particular system, but not in any of the other systems. And because the veteran needed assistance from multiple places, they wouldn't get that assistance because the person only knew their own system and didn't know where to send them to take advantage of the other opportunities that other systems might have, the other resources and programs. So when we look at coordination and integration, we had a few promising practices here as well. One of those is really trying to use HUD-VASH, the VA supportive housing voucher case management that comes with the HUD vouchers in non-traditional settings. So really being creative about how vouchers are used and how they might be used in different settings with potentially other funding to pay for those the additional services that might be needed. We also found some cross-system partnerships that were really unique and really seemed to tap into meeting the needs of veterans. One in particular that you'll see in the report is in New York, where you have a permanent supportive housing provider working with an aging program that provides services working with an adaptive technology program that provides adaptive devices for people who might need them for different life activities, work, but also housing and those kinds of things. So those were the promising practices there. And then the recommendations we had in this coordination and integration theme, we had several of them. The first one is specific to VA and to VA's Homeless Programs Office, and really pushing the idea of having a staff position in the Homeless Programs Office whose job is really just to coordinate all of the Homeless Programs Office programs that serve this population, but then also connect as well to other VHA programs that serve this population and VBA programs that serve this population. So to really have a position whose job it is to help coordinate services on the veterans, specifically within the veteran system on this side. And then the other recommendation we have here is really working to bring together leaders, policymakers, providers, other stakeholders in those three big systems that I talked about, aging, veteran, and homelessness, to really talk about how they can collectively work together, coordinate what they might be able to do to better serve this population and to make it smoother and easier for everyone. Okay. Oops, I think I double-clicked there. Sorry about that. So our next category, our next theme is around support services. And when it comes to the support services, we sort of divided this category into three sort of different ways to talk about services. The first was just the kinds or types of services that this population needs. The second was accessing those services. So how do they get those services? And then the third is navigation, which is more about helping them figure out what they're qualified for, what they're eligible for, how to get those things. And so when we looked at the types of services that this population needs, it really spanned the gamut. Some of these things are not unique to this population, like case management and medical services. They certainly take on a different nuance with this population. If you remember at the beginning, I mentioned that a lot of those adults over 65 have at least 3 chronic conditions. And so if you're managing multiple chronic conditions, as well as perhaps a substance use disorder, or you have trouble navigating your activities of daily living, that's what those ADLs are, activities of daily living. And that includes things like, being able to feed yourself, being able to bathe yourself, self-care, those kinds of things. Also the IADLs, which are the instrumental activities of daily living. And those are things that require more thought, more complex thinking. So think about like managing medications, managing finances, preparing meals, not just feeding yourself, but preparing meals. So all of these things working together, there's also the need for legal services. And one that I'll point out specifically on the bottom here of the types is this idea of social connection. We heard across all of the different methodologies that we used in this project, the importance of social connection and the isolation, to combat isolation and loneliness, specifically among this population of aging veterans who are unstably housed or unhoused. So that was a huge thing. So there's that piece of it, which is what are the kinds of services they need and how do they, can they get them? Are they able to get them? And that kind of leads into the next aspect here, which is the access to services. We found it really interesting because you'll see like services can be on site or they can be mobile and like come to you, and that's fine. That makes sense. But when we look at technology and transportation, those were really unique because they came out, we heard about them being both a kind of service that this population needed. They needed help with technology, they needed access to technology, but technology was also a way for them to access the other services that they needed, right? So many things are now accessed exclusively through online portals. That got even more common during COVID, that the way to get to things, the way to get to your benefits is to go online and fill out something online. And so technology becomes both a service that they need right? They need to be able to have technology to use it, but also something that helps them get their services. And so without that technology or those skills to use that technology, they're missing out on other services that they might need as well. And transportation is the same way. Transportation is something they need to get to the places, but it's also an access point for how they might get to health appointments, case management, mental health, whatever that might be. And so part of what we heard around access is like the ability to have on-site services as much as possible, or services that come to the veteran, is really important. And then the last aspect of the support services that I wanted to touch on is this idea of navigation. And we really heard over and over again the importance and the benefit of having navigators that helped aging veterans to get the services that they need. And so that navigation, primarily we heard navigation around benefits, what they're eligible for and how to apply for them, and then how to get them. Navigation around housing, how to look at housing, how to get housing, how to assess housing, how to pay for housing, but then also the importance of peer navigators and peers in helping this process in the process. So again, we had some support. So we had some promising practices in the support service category. One specifically, there's a pilot out in California called VSSR, the Veteran Support to Self-Reliance Pilot. It's a pilot that is actually looking at adding intensive kind of case management, but also intensive support services, health, other things to people in permanent supportive housing. Beyond what they would normally get. And so there's more information in the report about that. We also heard a lot about having events and community building and things that could really help address that loneliness and isolation that I mentioned. We heard about the importance of using project-based vouchers or PBVs, and the benefits of PBVs address the services, as I just mentioned, that idea of access to services. When it's project-based and there are multiple voucher holders in one place, it's easier to have the services on site and to bring the services to people. And then that helps with the access challenges and some of the other things that I talked about. And then also some enhanced project-based voucher funding for staff for HUD-VASH. And again, there's explanations of that. I don't want to take up all my time going through that. So the recommendations around the support services category, we really want to promote more affordable home-based care models and systems, but also to make sure that those models and systems can be adapted for people who might not be housed. Home-based care seemed to be really important. It would help people age in place and would help them stay where they wanted to be. But when you have a veteran who's experiencing homelessness, if it's a home-based model, it has to be adapted so those services can be brought to somebody who might not be housed and who might not be permanently housed. We also want to think about adapting like program and service provision at the different service entry points. And so again, that includes like emergency shelters and stand downs and transitional housing to again, make sure they can meet the needs of this specific population. We want to make sure that we're using progressive engagement. When we think about this population, I've been saying aging and elderly veterans who are experiencing or at risk of homelessness, 50 and above, that is a very heterogeneous population. Each of those veterans has unique needs. And so we really want to think about progressive engagement and targeting the interventions to meet the specific needs of that individual veteran. And then we also want to just work to ensure that there are more options for additional care and support to add on to folks who might be transitioning from one type of care into another type of care. And the most common example of that was somebody who might be in permanent supportive housing, but is transitioning to need more assistance with daily living or IADLs. And so they need a little bit more support to stay in the housing that they're already in. And so really trying to figure out how we can provide that extra support so that they can stay where they are and age in place. Okay, so our final theme, and then we'll get into breakout rooms in just a couple of minutes, is this whole idea of the complicated funding streams around serving this population and how it really does make it more difficult for the veterans to get the services that they need and are eligible for, but also for the people who are trying to serve them to provide the services that those veterans need. And so one of the things, and this is probably no surprise to many of you, but what we found is that every single program seems to have a different eligibility requirement, whether it's age, whether it's veteran status, whether it's income. There's all sorts of eligibility requirements, and they're not universal. When I talked about those different levels, state versus federal versus local, those are all different. Across systems, they're different. So that's really a challenge. The different restrictions that come in with the funding as to what that money can be used to pay for often requires some really creative braiding and other other ideas about how to pay for things from different pots of funding. We also heard, interestingly, and this came mainly from the veterans themselves in the focus group, but this idea that they often found when they were trying to access non-veteran specific services, that there was this assumption that the VA just handles everything veteran related. And so that if it was that a veteran would come and they would say, well, the VA handles that, the VA takes care of you. And part of this came from this idea of scarcity of resources and services. And so if the VA is there, the VA can help the veteran, and we're going to help the non-veterans. And we heard this over and over again from the veterans. And we all know the VA does not do everything and cannot do everything alone. And not all veterans are eligible for all VA programs or any VA programs in some cases. That connects back to this idea of resource rationing, that there's not enough to go around. And so it's really challenging to figure out who's going to get the funding to do what things, and which veterans are qualified for which services. Gaps in funding, which we talked a little bit about already, and then also the reporting requirements. Many of the providers talked about having to sort of braid multiple funding streams together in order to meet the needs of the veterans, and each of those funding streams has different requirements for reporting that can become very burdensome on the provider side. Okay, so now we're into our promising practices for the funding streams. We have a couple here. One is this idea that there's several communities are doing this and doing this in slightly different ways, but leveraging Medicaid and Medicare funding to provide the services that might be needed for somebody whose housing may already be taken care of. So if somebody has a voucher, whether it's a housing choice voucher or a VAS voucher, or in some cases, maybe they're in some other kind of subsidized housing, but leveraging that Medicaid and Medicare funding to do the service side of things that allows them to stay in that housing. And the other promising practice here is a specific development called Colma Veterans Village. There is a link in the report so you can learn more about that, but there's some creative stuff that they've done there with financing the project, but also braiding funding streams from different streams to sort of help serve those veterans that are living there. And then lastly, here, our recommendations for this project is really to create to sort of promote these new and promising strategies and look at some of these promising practices to really see if we can expand some of these. Some of them are pilots. Can they be taken to scale? Can they be adapted? And many of them are leveraging vouchers. And so can we do that in a way and take them into to scale so that we can meet the holistic needs of the veterans, not just their housing, but all the service needs that come with that, service and healthcare needs that come with that. We want to encourage flexibility in funding, so it makes it easier for providers who are working with this population to meet their needs, and they're not, sort of robbing Peter to pay Paul to try and to meet the needs of the veterans. And then lastly, to innovate and really promote some flexibility in HUD-VASH to make sure that they can combine those vouchers with other funding sources within VA or within mainstream services or local or state funders, to provide those services that the veterans might need in order to be housed and stably housed. Okay, I'm going to take a breath and take a pause there because that was a lot to cover. What we're going to do now is we are going to actually break out into breakout rooms. Okay, everybody, welcome back. I hope everybody had a chance to have some good conversations in those breakout rooms. I would like to have each of the staff members just share one thought, one theme, something that was discussed in their room so everybody can hear. So we'll start with group one. Jay, could you share something about the housing needs group?
Absolutely. And I think this also speaks a little bit to one of the prongs of the nuanced housing needs. So that adaptation portion. A couple points that I thought stood out was this idea of um, the need for social or like community need. As you age, that social circle tends to shrink, and so that carries open, it carries out or a new opportunity or space to consider like things like shared housing or partnering the tenant with another roommate just to kind of help them age in place. I thought that was something that was pretty interesting and something to consider.
Great, thank you. David, how about system coordination and integration?
For system coordination and integration, we had a pretty good discussion. What I'm realizing is that, of course, there's for the report, there's a lack of that, but for the providers and folks helping vets, they're creating their own local networks where they use their relationships to get what stuff done for the vets that have multifaceted needs. So it's it does need to go up to a higher level where it's more top down, but at the bottom level, a lot of folks are doing that working together and reaching out to see who can help with what situation.
Great, that's awesome. Okay, group three, Ife, services.
Yeah, so I did get a lot of comments, a lot of very helpful comments. I'd say two of the most important things that we should expand on is that a lot of pets, or not pets, but just service animals, ESA, they are usually a barrier to many support services provided as well as housing. And another was that the corrections, part of it is not frequently explored. A lot of aging vets may have, something way in the past, something say from the 70s that they may have not been able to expunge or take off of their record. And something also that may change, that may follow them is the substance use disorder, and support for that is also very known. And of course, I noted that this was covered in the report as well. So thank you.
Great, thanks, Ife. And last but not least, funding, Spencer.
Yes, specifically, there was quite a few comments on just the lack of ability to navigate options government-wide. People not knowing what they do not know and having access to the programs that they believe that are accessible to the individuals that they are servicing, while not, accessing anything within the VA or from VA service providers, not accessing programs outside. Like there is no active military one source for all of these programs outside the National Resource Directory, which plug nrd.gov. But there was also a derivation of that, which is basically the type of funding needs to be looked at, not just the one-off, we're going to take care of this issue and get one batch and tranche of funding, but legitimate funding over time that will support jobs long-term and confidence in these programs.
Excellent, great. It sounds like there was tons of great discussion in all of those groups, and so we'll be capturing that as well. What I'm going to try to do, let's say that, is I'm going to try and share the results of those questions that you guys did on Menti before. So hopefully you guys can see this now. So we had 264 responses to this, and you can see the bigger the word means more people said it. I think if we delve into this, we'll see that some of them are very similar. It's just slightly different wording, but that's the way that works. But you can see there's a whole bunch of things on here: income, transportation, affordable housing, mental health, technology, healthcare, not enough support, substance use, lack of resources. I see a couple of things around places to stay for women specifically, and I know there was something in the chat about women veterans. Decline in mental and physical health, income that's declining, tenant selection criteria. So there's a whole bunch of stuff, and we'll capture this too. So for everyone who did do this, I really appreciate it. I think sometimes having a visual is really helpful. And you can see, there's a lot of I don't know, consistency in what some of these are, even though there's a lot of words on here. As I look into them, some of them are just slightly different ways of saying the same thing. And I think it helps us further define the challenges that all of our folks are sharing. Oh, so let's see. I hear that somebody says they can't see. So let me see if I can actually. There we go. Can folks see it now? Not if you can see it, Spencer. Can you see that? Yes. Okay, perfect. That was my, I need a technology navigator to help me with that as I switched from different screens on my computer. So you can see the word cloud here, but you can see a lot of the things that I was mentioning there. There's stuff about technology and cost, support, substance use, income, health, all of those things. So really appreciate everybody filling that out for me. We're going to go back to our slides. And we're just about wrapped up. So a couple of things here just as next steps of what's going to happen next. I think it was several people asked in the chat, and I think David had answered that in the chat. We will be sharing the recording of this and notes out to folks, to everybody who came. But one of the things I mentioned early on is that we have a feedback form that we've created. The link to this will be in the chat. For folks who work at the VA, I apologize, it is a Google form, so you may have to do it from a private computer. But it is a feedback form that gives you the chance to add any additional feedback on any of the themes that we've talked about today, or anything that we didn't cover specifically. We didn't specifically talk about women veterans aging, and I know that was in one of the chat comments. So the way that the feedback form is, I think the only thing that it requires is an email address, and that's just because that's the way the form works. All of the other questions are optional, and there is a set of questions for each of the 4 themes. And then there's a set of questions that are just general overall questions. You can answer any or all of them. So it's really a chance for us to capture as much feedback from you as possible about this work that we're doing. And specifically also next steps and where we go from here. There is a place on that form to indicate if you're interested, as we are planning future events, future resources, future projects. If you want to be involved or be kept in the loop, there's a place to put your name and email address in that form as well. So I encourage everybody to go in there. And if you didn't get a chance to talk, or if you thought of something else afterwards, or you have something from a different theme that you weren't in that group for, please use that feedback form. And the link will be in the chat for you to do that. We are going to be hosting a session on aging veterans at our upcoming conference at the end of May here in DC. And it's still taking shape as to what is exactly it's going to look like and how it's going to, who will be involved in all that, but there is more coming with that. And then as we process everything from today, we'll be coming up with additional next steps and when we move forward from here. So I'm going to stop sharing. I have my email address here. I'll leave it here for a second, and then I'll put it in the chat too. Just for a second, we have a couple of minutes, like really a couple of minutes. If anybody has any last minute questions in the chat or any ideas they want to share, I did really want to thank all of you for taking the time. I know everybody's busy and asking people to take an hour and a half, an hour and 15 minutes out of their time to come and listen to us. But also share. It's really important. We appreciate it. And this project started because it was people like you who had been saying to us, more needs to be done. And we're trying, this project is our first step in being responsive to that and finding out, better understanding the challenges, better understanding the issues, and figuring out how to move forward. But we also do that with you and with your help, and we appreciate that help. So any other comments or anything, I will double check and just make sure that David drops that. I think he did already, drops the Google link in there. The form looks daunting because there's a lot of questions, but you don't have to answer them all. Please, it's really just a chance to answer whichever ones. We do want to get as much feedback as possible. And we do appreciate all the work that you every day. We know serving this population is hard. Serving aging veterans and elderly veterans has its own challenges and heartbreaks and successes. But I think that the challenges and heartbreaks sometimes seem to be more visible, more overwhelming. And so we're trying to do our best to see what we can do to make this better. for you as you serve them and ultimately for them and their quality of life, their housing and all the things that they need. So we appreciate you. If there's any last comments in the questions, you can go ahead and drop them in, but thank you all for your time today. Please keep in touch. You have my email address. I'll put it in the chat box as well, but any and all comments and feedback are welcome. Thank you again.